Hello, Namaskar. I am Dr. Murali Manohar. Welcome to my lecture, Ayurveda Samhita. In this program, we will be learning and knowing about an important topic and some powerful ancient Indian Ayurvedic secrets. These can change and improve your entire life. In this program, I am going to talk about how to stop worrying about a disease. The most common phobia, the most common fear that most of the people they suffer. Everyone worries about getting a serious illness sometime. But when occasional concern turns into a morbid obsession that interferes with daily life, it represents a serious psychological problem. This is called hypochondria in medical terms and atatvabhinivesam in Ayurveda. Hypochondria is surprisingly common. 1 in 10 people who visit doctors' offices have the disorder to some degree, and 3 out of 4 patients have emotional problems that exacerbate their physical symptoms. Unfortunately, few primary care doctors take hypochondria seriously. Psychotherapists too have a poor track record. As a result, the majority of hypochondriacs suffer needlessly. But there is good news. The outlook for hypochondriacs who get proper Ayurvedic treatment is now excellent, thanks to psychoactive plant-based drugs like Brahmi, along with refinements in Panchakarma therapy. Now, what causes this hypochondria? Let us know. Hypochondriacs are not pretending illness. You should remember this. Their symptoms are real, but it's their interpretation of these symptoms that is unbalanced. For example, everyday aches and pains are to the hypochondriac, they are in fact the serious illnesses. Hypochondria usually begins in the 20s or 30s, although it can develop at any age. The condition is often portrayed as a woman's disorder, but it's just as common among men. Single people seem to be especially susceptible because they spend more time alone, and loneliness encourages preoccupation about one's own health. Hypochondria has a biological basis, a pattern of neural misfiring in the brain that makes the individual usually sensitive to physiological sensations. Another thing, upbringing may also be a factor. Studies show that children of hypochondriac parents show more disability and suicidal behavior than children from normal families. Presumably, the children are simply mimicking their parents' behavior. Parents who are overprotective unintentionally cause their children to grow up to be excessively vigilant about their health. Hypochondria is simply a strategy for coping with emotional trauma, the death of a loved one, divorce, etc. The emotional pain caused by such trauma is so awesome that the person buries it under an obsession with disease. Okay, you are suffering from this problem, then what to do? There are some guidelines. You can learn to recognize the irrational statements you make to yourself and can learn new ways to interpret and respond to your symptoms. Another thing, you can learn to replace disturbing thoughts with alternative methods of relaxation like breathing techniques, relaxation exercises, and rational strategies. Then, who should seek the help? This is also important. Seek help if you answer yes to any of these 4 questions. These 4 include: when you hear about an illness, do you fear you have it? Another question: do you often ask family and friends to reassure you that you are not ill? Another question: are you obsessed with one particular disease? Another question: do you doctor shop, in the sense go from doctor to doctor, rejecting one diagnosis after another? If you suspect you may have hypochondria, seek the medical help. Then the Ayurvedic treatment plan. Let us know this. The most important thing is dhara. Another treatment modality, adravya bhuta chikitsa, like dhyanam, japam, mantram, etc. And important treatment modality, phytotherapy with psychotropic herbal-mineral Ayurvedic medicines like Brahmivati, Mansamitra Vatakam, Vachachurnam, Aswagandha Churnam, etc. So, basing on your pulse, basing on your attitude, basing on your body type, these psychotropic drugs should be prescribed. If you follow all these things, then you can overcome from this disturbing problem, hypochondria. So, hope you have enjoyed this topic and enlightened. In the next program, we will be meeting with another interesting and important topic. Shatam Jiva, Sarado Vardhamanaha. Shatam Hemantan, Shatam Vasantan. Live your entire life with excellent health and total happiness. Take care of yourself. Subham.
Dr. Chirumamilla Murali Manohar, MD, Ayurvedam, Raksha Ayurvedic Center, Sardi Studios Road, opposite State Home, Amirpet, Hyderabad 73. Phone 9177445454.